Identify the tag structure. Gabby here from bootcamp.com. In this video, we'll be discussing some of the structures that make up the distal portions of the midgut. Now, to orient ourselves with this image, I want you to actually turn your head slightly towards the left. So make sure your left ear is touching your left shoulder. So if we have a look at this, I want you to imagine that this portion of the screen or of the image, this is going to be superior. So you understand why I'm asking you to tilt your head. So this is going to be the top or the more superior portion of the body. Therefore, this right here would be inferior. So if we have superior, inferior, right over here is going to be medial. And the reason that I know that this is medial is because I'm able to see the small intestines that have actually been cut out in this particular image. But those are the small intestines that are found more medial to some of the structures that we're seeing right over here. So if that's medial, this over here is going to be lateral. So coming from the medial side, right, I mentioned that we have the small intestine. And we know the small intestine is made up of 3 different components. From the duodenum, we then have the jejunum and then the ileum. And in this particular section, we're looking more laterally towards the right. So we're actually looking at the more distal portions of the small intestine, meaning we're going to be able to see the ileum. So the ileum will continue right over here. It gets cut out, but it continues and then eventually attaches to this area over here or drains into the ileocecal junction. And the ileocecal junction is the connection between the ileum of the small intestine and the cecum of the large intestine. Now we know that the cecum is the first portion of the large intestine that eventually connects with the ascending colon. So the cecum is found right over here, and then as we travel more superiorly right over here is where we'd be able to find the ascending colon. Now the cecum itself is fairly easy to identify because it is fairly large compared to the other areas of the large intestine. It is an area that is fairly dilated and can distend quite a bit. Now the cecum is primarily responsible for receiving the waste from the ileum of the small intestine and will begin to absorb the water, the vitamins, and nutrients that are found within that waste, and eventually that waste will continue to ascend along the ascending colon into along the other aspects of the large intestine. Now we know that the small intestine and the large intestine have a variety of differences, 2 of those being that the large intestine contain the tinea coli as well as the haustra. Now the tinea coli are essentially these muscular projections of the actual GI wall that will contract and allow for the formation of these haustra, or these sacs, these small little sacs that are essentially found along all aspects of the large intestine. And this essentially allows the movement of waste as well between the haustra or between the areas of the large intestine. Now, if we have a look at the posterior surface of the cecum, so if you're in lab, find the cecum, it is normally a lot larger compared to the other aspects of the large intestine, so you can usually see it within the right lower quadrant. So grab that cecum and flip it over and look at its posterior surface. Along its posterior surface, you're going to be able to see an extension of the cecum or a diverticulum that extends from the cecum, which we can see it over here, and takes on this worm-like appearance. So this specific structure right here is the vermiform appendix, and vermiform essentially means worm-like. So this appendix looks worm-like. Adjacent to the appendix, we're going to be able to find the mesoappendix, and the mesoappendix is an extension of the peritoneum that provides more structural support to the actual appendix. Now, you may have heard of an acute condition of appendicitis where there actually is inflammation of the appendix. Now, the appendix itself is a vestigial organ, meaning that we don't know what its evolutionary function is. We have a general idea that it plays some role in help fighting bacterial infection and also providing a healthy microbiome to the actual GI system. We don't really require it to live. So in cases of acute appendicitis, where there might be inflammation of the appendix, where it gets to the point that it causes so much pain because it's about to burst, the appendix can actually be resected or removed without any complications. So in this case, for our question here, so identify the tag structure. The structure right over here is going to be the appendix or the vermiform appendix.